My name is Kabisa Mwala. I'm from Zambia, which is central and southern part of Africa. I'm currently from a hospital which encompasses cancer diseases management. This is at the University Teaching Hospitals of Lusaka, under the umbrella of Cancer Diseases Hospital. As you may know, that Zambia is part of a what you might call a third world country, but we are developing. As such, our cancer services are still in their infancy. One of the things I should mention upfront is, even if we are still developing, we have a cancer diseases hospital which has been established for about 10 years now. It is offering many services to do with radiation oncology and medical oncology. As such, we do not have much of surgical skills, surgical oncology in that line. For that reason, I'm here at Tata Hospital to actually undertake that kind of training. We from that part of Africa share almost the same incidence of cancer world over. Currently, it's estimated at 136 per 100,000, and it's increasing because we also have embraced the awareness programs. At the backdrop of the much needed human resource which is lacking, and it's for that reason that Merck Foundation, through partnering with our local government, Ministry of Health, we were given this opportunity with my colleagues in the Merck African Oncology Fellowship Program to come and undertake a one-year surgical oncology fellowship here at Tata Memorial Hospital. The uniqueness of this program is that there are a number of opportunities to get exposed and to get knowledge. One of the things that I found peculiar is that they have this human resource in terms of teachers and trainers and professors, and also the huge numbers of patients that you tend to see, and that gives you a much needed exposure within a shortest period of time that you can have. I come from a part of the world where we have this huge burden of cancer diseases as part of non-communicable diseases that are on the increase. And yet the human resource which should provide for that care is inadequate, especially on the appropriate surgical services. As you may know, that cancer management is not done by one individual. The appropriate management is multidisciplinary. As such, you need all the areas or the facets of cancer treatment at that center. So this exposure, this training is going to bring to fore have been lacking for the past years that our cancer center has been in existence. In addition, it's going to provide also a platform for linkages with my colleagues that I've met, also to improve on the cancer care as a region, also to participate in cancer research, and not forgetting also the important linkages that we've created with our teachers at Tata Memorial Hospital. I think it's been awesome. They are very willing to continue the learning, the mentor-mentee relationship, which is very important. That's on a personal, and as a country, I think this is just a stepping stone. I guess it's an opportunity that has been given by Merck Foundation, and I think a lot more people can benefit from this opportunity to train those who are very keen to offer the oncological services in my country, especially in the surgical arena, because we've been lacking to provide that appropriate service to our people in Zambia. The exposure I've had so far, the past 6 months of being around Tata Memorial Hospital has been great in that you have a huge patient load, and the expertise that is available for these patients is actually great. The other key thing that I noted in their management was that as a surgeon, since they're the ones who perform most of these diagnostic procedures like biopsies, they're actually in the forefront to administer chemotherapy, to prescribe chemotherapy, which is, I think, which I can learn from here and translate it into my country, it being a developing country, and we want to reach as many people as possible because we might not have the much needed human resource. So I think that was very, very important for me to learn and appreciate. The others, I think it's more of skills which I'm going to help my people when I go back after 6 months. I know we come from different backgrounds, but one of the things I've come to learn, I think that will cut across, is to utilize this training exposure much to appropriate to your country's needs, because I think we are different, and as such you need to make use of the shortfalls that you have in your country so that you can be more useful when you go back. So far my experience has been tremendous, and it would not be wise to say a great honor and thank you to Merck Foundation for giving us this opportunity and privilege to come and gain knowledge, experience, and go and help our people back home through the Merck Africa Oncology Fellowship Program. Thank you.